Forces of the Federal Republic of Nigeria, His Excellency Bola Ahmed Tinubu, GCFR, in December 2025, on the recommendation of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. I remain very grateful to Mr. President and the Honorable Coordinating Minister of Health for finding me worthy of this opportunity and privilege. As stated in my letter of appointment, I assumed duty on the 1st of January 2026. This appointment holds personal significance to me, not just as the 8th Chief Medical Director of UPTH, but also as the very first Uniport UPTH trained medical doctor to be so appointed. I am a full breed of this institution, having received my undergraduate medical training and residency, that is postgraduate medical training, from this institution. I was employed here as honorary consultant in 2005 on the completion of my residency training. I was appointed head of Department of Chemical Pathology in 2007 and served in that capacity till 2015. I really count myself privileged to have trained and served under quality teachers, seasoned and internationally rated medical professionals and mentors, some of whom are here, who instilled in me strong values, professional and ethical discipline, as well as the length and breadth of vision that have enabled me come this far. I am thus passionately attached to this assignment. Permit me at this point to salute an important individual in my life, my leader and special mentor, Chief Barrister Nyesom Ezenwo-Wike, GSSRS, CON, Life Bencher, and Minister of the Federal Capital Territory of Nigeria. As a product of his tutelage in public service leadership, I owe him a debt of gratitude for inspiring the ingredients of vision, passion, service, and determination in me. These are very critical success keys for anyone occupying any public service position of high trust. I have long keyed into the renewed hope agenda of Mr. President, especially as it relates to the transformation of the health sector for effective service delivery. It is indeed quite humbling and instructive to reflect on the popular expression, how time flies. So it's already 100 days since I mounted the saddle of leadership as the 8th Chief Medical Director of this tertiary health institution, one of the second generation established by the federal government in the 80s to serve our people in the Niger Delta geopolitical zone. No doubt, the past 100 days have been demanding, revealing, challenging, but quite promising. A lot of work clearly needs to be done in terms of personnel, facilities/infrastructure, service delivery, and staff reorientation. There is serious need to rebuild and improve public trust in our institution. This press conference provides an opportunity to render my account of stewardship within the period of 100 days I have been on the saddle, piloting the affairs of the institution with the support of my esteemed management team. The milestone of 100 days in office is now an accepted assessment parameter in our socio-political lexicon. No doubt, it is an assessment template for evaluating performance of public office holders. It can be reasonably argued that it is a very short time indeed to expect any reasonable impact, but it is also true that the egg that will hatch into a chick will be seen from the very first day it is laid. 100 days in office may be too short a time to see and feel tangible changes, but not too short to begin to see moves and policy changes that will propel the type of development we will begin to see and feel in the years to come. My first resolve as I assumed office is to run an open-door administration that allows for a bottom-top approach to governance. I am available and avail the staff the opportunity to meet me as individuals and in groups to ventilate their feelings and provide reasonable pathways to the resolution of the issues. This method serves to reduce tension within the system and pave way for development and proper engagement. The next odious task was that of selecting the team with whom I will drive the vision of repositioning the hospital. This task was made easy for me with the help of the very cooperative MDCAN UPTH and our target-driven coordinating Minister of Health in the absence of a board. With my team fully constituted, we promptly followed up by undertaking strategic engagements with key stakeholders, both within and outside the hospital community, since this health facility operates within a broad ecosystem. The outcome of these engagements have been very useful, both in guiding our approach and strategies towards the task we set for ourselves, and also for getting the needed assistance to achieve our objectives. Our modest achievements are captured within three broad categories. 1, institutional/service performance. 2, infrastructure development. And 3, innovative initiative. Under institutional and service performance, A, staff verification. I met an institution with about 4,000 staff on the payroll, both IPs and GiveMes, but about 2,000 members of staff on ground in the various categories. The difference represents staff who are not coming to work, have eloped or retired and still on payroll, or staff on study leave who have overstayed, not bonded or monitored, but still on payroll. We responded to this challenge by constituted a staff verification committee whose composition cut across the various unions and service strata of the institution. The result of the verification exercise, which has been submitted to the management, will help us get the accurate nominal role for this hospital, because I did not meet any nominal role as I assumed duty. There is no nominal role for this hospital as we speak. And we'll also reposition staff for effectiveness and efficiency, financial system integrity, and fee for service. One of the key gains of my open door policy and bottom-up approach to administration is the access to critical information from major stakeholders within and outside the hospital environment. We got and observed a lot of revenue leakages and pilfering in the system. We confronted this by introducing an integrated health management and information system for tracking hospital revenue and processes. This is in line with the federal government's Treasury single account policy. We also identified the need to make services of hospital more user-friendly and affordable, considering the vulnerable members of the public that we serve. Accordingly, we set up a committee to review charges downwards. The management under my watch, within this 100 days in office, have reviewed the mortuary fee downwards considerably. Management noted that feeding is an integral part of medical management of inpatients and must be looked into. Accordingly, management has set up an inpatient feeding committee and has made feeding of inpatients mandatory at a very minimal cost of just 5,000 naira per patient per day. This will cover breakfast, lunch, and dinner. It is the duty of the committee to ensure the quality and quantity of food served and ensure that they are in order. Expansion of services provided. We have also set up 7 different committees to enhance the services provided and ensure that we begin to function as a tertiary healthcare provider and not just as a glorified general hospital. These committees include a kidney transplant committee, bone marrow and hematopoietic stem cell transplant, the simulation committee, incineration committee, oncology and cancer treatment committee, infection prevention and control and antimicrobial stewardship committee, emergency response committee. Training. In order to reposition and strengthen the training of relevant medical and paramedical staff, we have focused on the restructuring of the training schools operating within the hospital and set up a committee to ensure that the committee approached their assignment with robust determination, and the process of affiliation has reached advanced stage. The management has coalesced the schools into A, College of Nursing headed by a provost, and B, College of Community Health and Allied Health Sciences headed by a dean. Infrastructure. A, access road. I could not easily access this health facility on my first day of assumption of duty because of the very poor state of the road at the entrance to this tertiary health institution. This was most unacceptable and unsettling to my medically trained mind. We approached this challenge with robust determination, and today that situation has changed. We will continue to work on the arterial road network connections in this institution to ensure easy access to all parts of this hospital. B, accident and emergency, the boardroom and CMD's office. I met a hospital complex with multiple areas of leakages. Most offices are flooded when it rains. This is militating against effective service delivery. We have assessed the length and breadth of this problem and come to the conclusion that it is massive and requires serious and urgent intervention. We have started making the necessary contacts and consultations. From promises we have gotten from the right quarters, this narrative will change before the end of this year. Of particular concern is the accident and emergency department of this hospital. This is the gateway, as it were, into this hospital. Most patients are admitted to this hospital through the accident and emergency department. I met this department in a very sorry state. I told my management team that this is totally unacceptable to me, as I cannot allow even my dog to lie in the A&E in its present state. We had to engage a reputable contractor to start massive but segmental renovation work. We just commissioned the completed section today. The project will continue until the whole A&E and indeed all wards in the hospital is transformed to befit a tertiary healthcare facility in a 21st century. The boardroom and CMD's offices were in very deplorable states. So much so that I had never sat in my office since assumption. I've been squatting elsewhere that does not also even look befitting. We decided to ensure that in 100 days of this administration, the CMD should begin to operate from a conducive office, and the boardroom should be ready and conducive for business of the board and management of this hospital. I am glad that this press conference is holding in the refurbished boardroom. The CMD's office, which we just commissioned a few minutes ago, bears testimony to the spirit of determination and resolve of the present management team. Our resolve is to make all offices in this institution conducive for effective and efficient service delivery. Power supply. I assumed duty and met an ongoing solar power project, product of President Bola Ahmed Tinubu's renewed hope agenda for education and health. This project, financed by the African Development Bank and Ministry of Finance, is executed by the Rural Electrification Agency. A massive solar farm with an installed capacity of 10 megawatt power, designed to serve both Uniport and UPTH, has already been installed and functional at the Uniport end. UPTH is supposed to get 3.5 megawatts of this installed capacity, and this is capable of providing 24 hours power supply to all the departments and units of this hospital. The UPTH component of this project, unfortunately, was stalled by logistic and technical challenges. As I assumed duty and got the full briefing, we engaged the contractors, Rural Electrification Agency, African Development Bank, and the Ministry of Finance. The result of this robust engagement is that the challenges have been largely resolved. More funds were committed and have actually been released to ensure finalization of the UPTH component. I am glad to announce here that the UPTH power problem will be resolved in less than a month from now. This is heartwarming, considering the fact that this institution is established to pursue 3 core mandates: service, training, and research. None of this can be effectively achieved without a fairly regular power supply. Today, we commissioned an 18 kVA power inverter plus 45 kilowatt-hour power lithium batteries mini-grid solar project for uninterrupted power supply to critical areas of this hospital. This morning, we just committed that, commissioned the one for special care baby unit. The one for the intensive care unit will be completed before the end of this month. Innovative initiatives. In order to ensure visibility of our institution outside the shores of this country and also attract international collaboration, that we position this teaching hospital as a hub for medical tourism, we have, within the short period of our coming on board, initiated the following: A, strategic linkage and interaction with alumni of our institution who form a significant mass of specialist manpower in the diaspora, thanks to the solid foundation they obtained while here as trainees and interns. B, exploration of international collaboration in research, exchange opportunities, and support that will enhance our repositioning efforts. I'm glad to disclose that we are beginning to reap the fruits of these efforts, as we have recently received donation from alumni bodies in the UK. Last week, we received a delegation from Austria who came to explore areas of collaboration with and possible assistance to our hospital. Conclusion. In concluding this address, let me specially thank our host communities, and in particular, the paramount ruler of Akpo Kingdom, His Majesty, Eze Ambassador Levi O. Amos Orluwene, JP, for his unparalleled support and peaceful disposition. I salute specially the paramount rulers and council of chiefs of Alakaya, Rumekini, Alo, and Choba communities. I salute the CDC and youth bodies in all these host communities. They have been very cooperative. I now extend my gratitude to heads of departments and units in this hospital for keying into the new vision. Let me specifically thank my management team, made up of men and women of vision and positive energy towards the development of UPTH. Permit me to mention them individually. Professor Richard Echem, Chairman, Medical Advisory Committee. Madam Erebi Wadiri, Director of Administration. Professor Justina Elebeleye, Deputy Chairman, Medical Advisory Committee, in charge of special projects and linkages. Professor Omosivie Madoka, Deputy Chairman, Medical Advisory Committee, in charge of research and innovation. And she is also the chairperson of the 100 Days Celebration Committee. Professor Olufemi Omitola, Deputy Chairman, Medical Advisory Committee, in charge of training. Dr. Kennedy Nkpobo, Deputy Chairman, Medical Advisory Committee, in charge of services. Pharmacist Tonye Opuda, the head of Pharmacy Department. Mrs. Victoria Amaboruju, the head of Nursing Services. Mr. So Atedo,